Thank you, Mr. Chairman, and I plead for the majority's consideration for the request in this amendment. Mr. Pasquale's discussion about concerns with care at nursing homes could very well have made the case for this amendment. In our case, people have died due to decisions that were made around the care in nursing homes, and we've been unable to get adequate information that the loved ones who have lost family members are looking for and continue to look for. We've previously asked for this information from the committee, and I ask today, I beg of you to take seriously this request. I'm talking about what was brought up before, under the leadership of Governor Tom Wolf, the Pennsylvania Department of Health followed Cuomo, the disgraced New York Governor Cuomo's lead, and adopted a policy during the pandemic that required nursing homes to admit COVID-positive patients. That fatal decision, made in only a few states, led COVID-19 to spread throughout Pennsylvania nursing homes like wildfire. And as a result, Pennsylvania ranks second in the nation in the number of COVID-19 deaths in long-term care facilities, with residents and staff accounting for more than half of all COVID deaths in the Commonwealth of Pennsylvania. In the district that I live, nearly 70%, tragically, of the deaths that occurred due to COVID occurred in nursing homes. Governor Wolf's failure to protect seniors didn't start with exposing nursing home residents and their staff to COVID-19, by the way. The governor and former Pennsylvania Department of Health Secretary Rachel Levine have a long track record of providing poor oversight of nursing homes even before the pandemic began. Pennsylvania lagged the nation in completing required annual survey inspections and infection control reviews. And as a result, Governor Wolf ignored that some facilities may be more susceptible to rapid transmission of the virus. Nursing homes with a pattern history of infection control deficiencies were left to fend for themselves as they grappled with the rising COVID caseloads. Facilities pleaded with Secretary Levine to prioritize them for PPE disbursements, help with testing and staffing shortages, but she responded, get this, Secretary Levine responded by removing her own mother from a nursing home. President Biden went on to reward her decisions by appointing her as the Assistant Secretary for Health at the U.S. Department of Health and Human Services. Our nation has many lessons to learn from the pandemic. There are many actions that we can take in the future to better protect the most vulnerable, but step one on the path to improvement is to have complete and accurate data. Yet there's a Spotlight PA report from September 2020 revealed that the PA Department of Health has consistently misreported death and case data for the state's nursing homes. Adding to the confusion, just yesterday, McKnight's Long-Term Care News published a story breaking the news that more than 16,000 COVID-19 deaths in nursing homes were omitted from federal data. And Mr. Chairman, I'd like to submit both of those articles for the record.
So ordered.
Thousands of families in Pennsylvania and across the nation lost loved ones in nursing homes. In fact, a personal friend of ours lost a family member when her roommate in a nursing home got sick, was taken to the hospital, and was required to come back when she had COVID. And our family friend, the friend of the family, a member of the family, died shortly after. This amendment, by the way, is named for a Mr. Mazirik, who lives in Tom Reed's district, Representative Reed, who never got to see his loved ones like so many others before they died in nursing homes. Folks, our constituents deserve answers, and at the very least, accurate reporting. This amendment simply instructs the Secretary of Health and Human Services to certify to Congress that the number of deaths of residents in skilled nursing homes match the publicly reported number in each state. Asking for that data, asking for complete data to understand the full impact of the pandemic within long-term care facilities should not be asking for much. We shouldn't even be in a position where we have to ask for this. Accurate data will help instruct future measures that can be taken to strengthen protections going forward. So I urge my colleagues to support this common sense measure.